Hi, my name is Todd Petrie. I am co-founder and managing general partner of Milestone Venture Partners, a venture fund based in Midtown. We manage $135 million and we invest in early stage software and data services companies that are solving problems in the healthcare ecosystem. We have made 18 such investments, and we recently had a first close on a new fund at the end of December. So we are actively seeking new investments, and we should have one or two to announce this quarter. David Fairbrothers and the Dorsata opportunity came across my desk a year ago, and I was impressed with it for a number of reasons. First, they're solving an important problem. Healthcare providers should take care of their patients according to best practices that are documented, researched, backed up consistently from patient to patient. Unfortunately, this is not happening. Patients with the same conditions, same fact patterns are being treated differently, which produces an enormous cost on our system. And it also means a very high percentage of patients are being treated suboptimally. Dorsata solves this problem, or helps solve this problem, by making a platform available to non-technical clinicians who can codify best practices, document those best practices, and make them available to clinicians at the point of care through an elegant mobile technology. It's intuitive to me, it makes a lot of sense, but more importantly, they have a number of marquee clients around the country that are validating the technology as early adopter customers. The other thing I like about Dorsata is that if we're gonna, it's the team basically. If we're gonna reform healthcare successfully, we need teams that can walk through walls, who are audacious, who are gonna take on big problems despite what skeptics are saying, and teams for whom it is second nature. It's like breathing to them to take off-the-shelf, state-of-the-art software, cloud and mobile technologies, assemble them in novel ways, and solve important problems inexpensively and rapidly. So with that, I'd like to welcome David Fairbrothers, co-founder and CEO of Dorsata.
All right, good. Thank you, Todd.
Thank you.
I do hope it's our work ethic and our intelligence that gets us through walls, and not that I happen to be a larger than average individual. Thanks for having us in today. I'm David Fairbrothers. I'm the co-founder and CEO of Dorsata, and we build software that helps doctors and nurses make better decisions and spend less time doing documentation so that they can get back to what they got into healthcare to do in the first place, and that's to take care of patients. So we think healthcare, and Todd talked about it, but we think healthcare has a who you see is what you get problem. And if that rings a bell like it did for me, I suffer from it used to be chronic low back pain because of many years of football. And if I had gone to see a surgeon, I would likely to be headed towards surgery. If I had seen an interventionist, it's likely that I was going to get a spinal injection. And this is representative of what we call unnecessary provider variation, and we believe it is one of the key drivers behind two of our most systemic healthcare issues. The first being a high degree of waste, and the second being largely poor patient outcomes. So this is both a financial challenge as well as a quality of care challenge as well. And so we spent the last 10 years and $35 billion of taxpayer money implementing and getting healthcare providers to use the electronic health record, in part to solve these challenges. But we believe that it's falling short of its promise so far. And we think it's simply and largely simply because the interfaces in these tools that the clinicians have to use day in and day out are beyond frustrating and painful and complex. So what you're seeing here is a pretty standard screen in a GE electronic health record, where you have numerous tabs, numerous notifications, and numerous reminders that all have to be interacted with, some of which are not actually applicable based on the particular patient that's being seen. And so what you're left with is an experience that Raj talked about, which is frankly painful for a clinician that has to interact in these interfaces every day. And so I was actually out at JFK after a meeting looking at this electronic health record in particular, and I thought, what would be a good analogy for how painful this actually is? And it hit me that actually using the health record is kind of as painful as going through airport security like 30 times a day, right? There are literally 50 things you have to remember to do. It's always changing. You finally get to the end at the metal detector and you forgot that quarter in your pocket, so you have to turn around and do it again, right? And so for us, we thought, why can't we make using the health record, using the electronic health record as easy as going through TSA PreCheck, right? Where there's nothing that has to come off, you're able to move through the line quickly, and it's just completely painless. And so that's what Dorsata really does for the electronic health record experience. It actually takes on the tedious and complex parts of the workflow that frustrate clinicians the most and organizes it into a clean and structured process where they're actually able to interact with it on a tablet in the room with the patient, not turning around like Raj did using the computer, actually looking at them and evaluating them, tapping the things that are pertinent so that everything that needs to be documented for that particular case is documented. And then Dorsata is actually asking pertinent questions to the clinician that would then determine the next series of things that need to be evaluated and things that need to be done. So it's actually helping the clinician make the decision and speeding their process of documentation up, not actually doing it for them, which we think is an important clinical distinction. So here you're being walked through what that experience looks like. Very touch-friendly on a Surface tablet. And what's most important about this is that the output of this work is actually a clean and clinically relevant structured note and set of orders that are sent back to the health record. So it's easy, quick, and painless for the clinician. And so this works because our experience is powered by what are known as care pathways. And so a care pathway is a set of clinical rules for delivering the highest quality of care to patients because they are supported by established best practices. So this is the underlying clinical knowledge that makes Dorsata think like a clinician and helps the technology actually surface pertinent patient data points and ask pertinent questions. And the beauty of then actually interacting with this experience during the course of a patient visit makes the electronic medical records documentation much more accurate, much more standardized and robust, with the best practices that were used to make those decisions cited right into the note. And so we think this has a few key value propositions for providers. So first and foremost, it gives each provider more time to spend with their patients and on patient care. So you should be able to see more patients every day and spend more time with each one. Second, because the documentation is being done to an established care pathway, it becomes much more accurate and much more robust. So the actual billing codes that go back to the health record are supported by what was actually seen in the patient prospectively in the room. So it should actually increase collections. And lastly, but certainly not least, because best practices power this experience, it will deliver a higher quality of patient care. So one of the things we think actually is really unique about our approach and why clinicians adopt our technology versus some others is that we actually give clinicians the ability to design the interface that they then will use at the point of care. So what you're looking at is a point, click, and drag experience where the clinician is able to actually architect the workflow that they then can use on the tablet in the experience that I showed you on the previous series of slides. So clinicians are actually building these algorithms, these pathways, at a number of prestigious academic medical centers. We've had at this point about 1,500 clinicians use the technology to consume and to create content. Over 750 pathways, in fact, have been built. We have built no clinical content. We're all software developers. There's 5 of us. And then lastly, we're working with Visiting Nurse Service on a few interesting use cases and have learned a ton from Allied Physician Group here in the program on the pediatric setting, which is a slightly different use case than an acute specialty care. We've built out an incredibly strong technical and clinical team. So the entire software development, design, and engineering is all done in-house. I used to write a lot of code. It wasn't that great, but at least got us off the ground, and now we've brought on a few people that know how to do it much better than I do. Recently, Dr. Dan Mazanek joined our team. He's from the Cleveland Clinic, having practiced in spine care for 30 years. But most recently, he led the development of their first electronic care pathway in low back pain, which had transformative results on imaging reduction, 60–70% in primary care, and reduction in opioid use, which is a very critical outcome measure for low back pain. I'm not actually raising money, which is a great thing in this audience. So we actually just recently announced a $1 million raise from a handful of institutional and strategic investors. QED is known for companies like Credit Karma, Fundera, SoFi, companies like that. And we're proud that the Health Accelerator was a part of that round. So that money is really going to do two things for us. First, we're going to launch our fully integrated solution with an Athena Health EHR at 2 physician groups and collect the outcome data and financial data that we know will support our value proposition. And then once we've done that, we'll have plenty of resources left to scale our sales efforts and grow to a larger audience. So later in the year, we'll be looking to raise our next round of capital. So what I'm here today to ask is if there are any clinicians, any partners, any investors, any health systems that actually appreciate our mission that we'd like to get clinicians away from the computer and back to performing patient care, please come talk to us afterward. Thanks.